we have not been able to marshal the needed resources to be testing en masse as we should be. But if in terms of recovery and the standard that we have adopted, that is what we are going to use to say that this person has recovered or not. It is low, but we should continue working on it.
Okay.
Let me stretch this to an appeal, and this appeal goes to community leaders. This is because, Kojo, if you test a patient as positive, and the patient is able to let you know that, oh, I live in this community, I met this person, I went to that house, I visited family ABC, and contact tracing is being done. When they get there, community entry techniques are very, very useful. And you need leaders in the community to be able to help you. Because once we lost the opportunity to contain the disease at the level that we should have contained it, and we saw the spread into communities, the horizontal spread. Now the disease is owned by the community.
Right.
That ownership means that the management of it must also include the community. And this is where I think government has not done too well in terms of bringing on board community leaders, assemblymen and women to assist in this. And perhaps we lost an opportunity during the distribution of food and other relief items during the lockdown phase.
We could have got them organized at that time.
If they had been included in the distribution of food and all, they may have also gathered a lot more social capital within the communities that, oh, even when we were hungry, it was this Wolome, it was this chief, it was this assemblyman who, together with government, brought us food. So let's listen to him when he says that we should subject ourselves to the team that is coming around to test us and all.
But my understanding was that's what government did. That was the process they described to us, that they were going to use community leaders to distribute these things. Unfortunately, and we read a lot and also saw clips. Unfortunately, that intention did not translate into practical application. And that was a failure that I think they had to address. They didn't address it, but we still need the community leaders. And so let's not give up, because when the disease is in the community, it must be owned by the community, and that ownership means that we need them to manage it. Right.
Because, Kojo, if you are going to allow your relative to go into the hands of government for, let's say, 2 weeks, it has all kinds of connotations. And the person, even if cleared afterwards, returning to that same community also faces stigmatization and all. And so we need a community-based approach to this. Like I said, we lost the opportunity to contain it, and we have seen massive horizontal spread, community spread. That means that the traditional leaders, the assemblymen, youth leaders, influential people should be brought on board to assist the gallant men and women who are working day and night to ensure the safety of everyone.
Right. Okay, now we're talking to Dr. Edward Omane Boamah. You know him. He used to be the communications minister here in Ghana under President John Dramani Mahama. Of course, he's a medical doctor. He's got quite a lot of experience with the management of infectious disease, particularly going back to Ebola, when he was you were the chair, weren't you?
No,
of the,
for very good reasons and all my other schedules. Victor Bampo was the chair.
Right.
I provided a lot of support.
That's right.
And I remember even when Tony Bambry came in, he was the representative of Ban Ki-moon at the time, the leader of the UNMIR, the United Nations Mission Ebola Emergency Response, when
they came to set up the hub.
Yep. And Tony Bambry had to be oriented in terms of how to explain what they were going to do in Ghana and for the Ebola-afflicted countries. Because at that time, we had all kinds of caustic noises that were being made around as if President Mahama was importing Ebola into the country. But at that time, President Mahama saw it as, look, even if this disease will enter our shores, there is wisdom in having the UNMIR headquarters here. And all the protocols also that went with ensuring that we didn't have the disease on our shores were thoroughly implemented. I remember even the case that traveled through the airport, Kotoka International Airport. As early as that time, contact tracing forms had been made available. So all the people who were on that flight, in that cabin, with that gentleman
from Liberia,
who went to Nigeria, they were contacted and appropriate public health measures put in place. So I would say that there are also some opportunities that we lost at the beginning of this whole pandemic, but we should move on and learn from the lessons of not working excessively and on time to ensure that we held the virus at bay.
I actually wanted to ask you about that because indeed there was quite a lag, between the first discovery of Ebola and Ghana's sort of mobilization. I know that it was actually in December 2013 that the first case was discovered in Guinea. And then it started traveling across the continent. We had it in Liberia, in Sierra Leone, in Mali, eventually in Nigeria after that gentleman came through Ghana, on a plane that came through Ghana. Nigeria had it in July.